Good morning. Thank you. I'm Vivian Gadsden, the committee chair for the Committee on Supporting the Parents of Young Children, and I want to welcome all of you here today and thank you for coming. We also want to thank our sponsors who have invested in the significance of this project. I want to give you a brief overview of what the committee has been asked to do. We are to inform a national framework for strengthening the capacity of parents of young children birth to age 8, to develop consensus recommendations to strengthen parenting capacity. Recommendations will focus primarily on federal, state, and local governments, the private sector, public education systems, and health and human service systems. Our report is anticipated to be released in spring 2016. But the full statement of task is available at the registration desk for those of you who are present here with us today, and is available online at the Institute of Medicine website for those who are joining us by webcast. And let me remind you that this we do have a webcast audience, and we welcome that audience. So for the format of today's meeting, the speakers have been invited to discuss various topics to support the committee's statement of task. For example, we have two panels, one focused with parents and one with practitioners, and we have been asking them to tell us a little about the various ways in which they have taken on the roles and responsibilities of thinking about and supporting parents, as well as the nature of their experiences. We also have 3 individual presentations. At the end of the meeting, there will be an opportunity for public comments during which members of the audience may present their comments to specific questions posed by the committee. To avoid any delays, presentations and discussion sessions will be timed, and I ask that presenters at the podium pay attention to the podium light. When it turns yellow, it is time to start wrapping up your presentation. So if you're colorblind, let us know. And when it turns red, your time is up. Staff will also notify you of the number of minutes you have remaining. And Anthony and Sarah are in the back. In addition, I want to note that this is an open, on-the-record session. Interested individuals have been invited to attend as observers. I also would like to remind everyone that this is an information gathering session. That is, the committee is in the process of assembling materials that it will examine and discuss in the course of making its findings, conclusions, and recommendations. Therefore, I ask everyone here today to be extremely mindful of the fact that the committee has made no conclusions and that it would be a mistake for anyone to leave here today thinking otherwise. Comments made by individuals, including members of the committee, should not be interpreted as positions of the committee or of the Institute of Medicine or the National Research Council. In addition, committee members typically ask probing questions in these information gathering sessions, which may not be indicative of their personal views. So, the committee will deliberate thoroughly before writing its draft report. Once the draft report is written, it must go through a rigorous review by experts who are anonymous to the committee, and the committee then must respond to this review with appropriate revisions that adequately satisfy the Academy's Report Review Committee and the chair of the Institute of Medicine and National Research Council before it is considered an Institute of Medicine and National Research Council report. So, thank you for bearing with us on that introduction. We're going to get started with our first panel, perspectives from practitioners who provide parenting support. And I'm delighted to introduce the moderator of that panel, Kim Bowler, who is a committee member and also a senior researcher at Mathematica Policy Research. Come on up. And ask the panelists to come